Hello everyone, I'm Arlene Brun from Tarlac State University College of Nursing BSN 1B. Body temperature is the heat of the body that measured into degrees. We have the purpose of body temperature. We have number one, to establish the baseline of the subsequent evaluation. Number two, we have to identify the core temperature within the normal range. And number three, we have to identify the changes in the core temperature in the specific therapies. And then number four, we have to monitor the patient at risk for the imbalanced body temperature. And then we have the equipment. We have number one is the digital, glass, or electronic that appropriate to use. And then number two, we have a disposable probe covering. And then number three, we have a water-soluble for lubricant rectal temperature. And number four, we have a non-sterile gloves. And number five, we have a additional PPE. And number six, we have a toilet tissue if needed. And lastly, we have a pen or pencil and computer recorded. Preparation. Assessment. Assess the client for first, significantly ear drainage or tympanic membrane. Second is the functioning intact. If the client could close his or her lips around the thermometer, and if the client cannot, the oral method is not appropriate to use. And then we have rectal temperature, recent review for the platelets count. And then we all know, as a nursing student, the rectum is very sensitive parts in our body. Rectal temperature is could also lead to rectal bleeding. And then we have a number for the axillary temperature. The ability to hold his or her arm to against the body. And then we have lastly is to the temporal artery temperature. Assess the patient to head covering. Assessment. Implementation rather. Check the nursing plan of frequency. And then we have a introduce yourself to your client and verify the client identity. Explain to your client what you're going to do, why it is necessary, and how the client can cooperate. Gather equipment. Make sure the digital and electronic thermometer is in working condition. Provide a client privacy. Close the door, especially the curtain, to avoid any problems. And then perform a hand hygiene. Put gloves if appropriate or indicated. Select a appropriate site and appropriate thermometer to use. Good day, ma'am. I'm your nurse Arlene from Tarlac State University. May I know your name po?
Riza Fable to
And after that, let's start po. So before anything else, perform a hand hygiene to remove all the microorganisms. And then after that, wear our non-sterile gloves. And then after that, let's proceed. If necessary, turn on the button and then wait for the ready signal. And then after that, attach the tympanic probe cover. And then after that, insert the tympanic temperature in the ear of our client by gently pressure. And then activate the unit by pushing the trigger button, usually within 2 seconds. Then after that, discard the probe cover. And replace the tympanic thermometer in its charges. And then perform a hand hygiene and don't forget to record the client result. And this is the end of the assessment for tympanic temperature. Assessing oral temperature. So before anything else, perform a hand hygiene. To remove all the microorganisms. And then after that, wear our non-sterile gloves. And make sure there is no excess. And then after that, let's proceed. So, ma'am, are you ready po? First is remove the electronic unit from its charging unit and remove the probe from with the recording unit. And then after that is cover the thermometer within with disposable probe. And then after that, we assume that this alcohol is disposable probe. And then after that, ask the patient if he or she ready. Ma'am, are you ready po? Open your mouth po, ma'am. And then, put the thermometer in the posterior sublingual of the patient. And ask the patient to close his or her lips and wait to hear the beep. And then remove the thermometer in the mouth of the patient. And then dispose the probe cover. And then after that is note the reading temperature of your client. And then return the thermometer in the appropriate storage place, and then return the electronic unit from its charging unit. And then after that, perform a hand hygiene and remove the gloves. And don't forget to note the client record. And then after that, this is the end of the assessing of the client oral temperature. Assessing axillary temperature. So before anything else, perform a hand hygiene and wear one pair of non-sterile gloves. The next one, and then after that, let's proceed. So, ma'am, are you ready po? And then, place the bed at an appropriate working height. Ayos po tayo, ma'am. And then after that, move the patient clothing and then expose only the axilla. Ma'am, can I roll? And then after that, remove the probe from the recording unit of the electrical thermometer. And then place the disposable probe cover on the sliding on as snapping securely. And then after that, place the thermometer in the center of the patient axilla. And then after that, have the patient bring down the arm down and then close to the body. And then close the, after this, wait to the beep to hear. And then and then finally, we hear the beep. And then after that, note the temperature reading. And then carefully remove the probe. And then after that, we can now cover the patient to the position in a comfortable and proper position. And then after that, dispose the probe cover. Dispose the whole probe cover by holding the probe over the appropriate waist respectacle and pushing the release button. And then after that, place the bed the lowest position of the client, and then leave his or her with a clean and comfortable bed. And then after that, return the electronic thermometer or electronic unit to the charging unit. And then when measurement is completed, you can now remove your gloves. You can now perform a hand hygiene and note the client record. So I will remove my non-sterile gloves, and then after this, I will sanitize my hand to remove all the microorganisms. And then after this, I will note the client record. And this is the end of the assessing of axillary temperature. Assessing the rectal temperature. So before anything else, perform a hand hygiene to remove all the microorganism and wear a one pair of non-sterile gloves. And then after that, place the patient into the bed and use a non-sterile gloves and here. And then after that, assess the patient into the bed and expose only the buttocks. And then after that, remove the rectal probe and cover with a disposable cover. And then after that is lubricate 1 inch with a water soluble lubricant. And then after that, separate the buttocks to the anal sphincter visible. And then after that, insert the rectal thermometer into the anal of the patient. And then um, if the patient is adult, 1.5 only, while if your patient is a child, 1 inch only. And then we can now insert the thermometer to the anal of the patient. And wait to hear the beep and carefully remove the thermometer into the anal of the patient. And then after that, dispose the probe cover. Dispose this into the appropriate ways. And then after that, use a toilet tissue to wipe the feces or any excess lubricant into the anal of the patient. And then after that, dispose the toilet tissue into the appropriate ways. And then after that, cover the patient into the comfort position. Help him into the comfort position. And then after that is perform a hand hygiene. Remove the gloves and place the patient into the lowest position. And then after that is return the thermometer into the charging unit. So I will remove the non-sterile gloves. Then I will perform a hand hygiene to remove all the microorganisms in my hand. And after that, I will note the client record. And this is the end of assessing rectal temperature. So the evaluation, the patient is accurately assessed without any injuries, and the patients experience a minimal discomfort. And then the documentation, record the client temperature on a paper or computerized or a book or a note in a notebook, something like that. And then report the abnormal findings into the appropriate person. And then after that is identify the site of assessment other than the oral.